Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
This week on Health Today, we take a look at palliative care, which helps define goals of caring for terminally ill patients. When serious illness strikes a loved one, it can be painful. Chronic, complicated, and life-threatening diseases can decrease a patient's quality of life, making it challenging to do simple, everyday activities. But those days do not have to be laced with pain. Your loved one does not have to be stressed or live out their final days to the beat of the symptoms of his or her illness. How is that done, you may ask? It's called palliative care.
It's also going to be very important that we explore what our own attitudes are towards topics such as death and dying, but more importantly, living. This is very important. Palliative care is about living. Palliative care is about living the best we can in whatever time one has available. And sometimes palliative care goes alongside treatments to control the disease. So for example, if you have someone who's got very advanced heart disease, heart failure, we continue the treatments to control the heart failure. But at the same time, we're having discussions exploring what are your fears, what are your needs, how is this impacting your life, how is it impacting the life of the family. And we're exploring things such as, are you depressed, are you anxious about what is happening, what information needs do you have?
Beyond the needed medications and treatments, chronic or terminal illnesses can be taxing on a patient's body and mind. Palliative care, Dr. Jose Pereira says, is a way to manage those symptoms and help patients improve their quality of life.
Any illness that is threatening one's life and potentially shortening it. So that's very important. And alongside with that, as people experience these illnesses, they experience many different needs. And these needs vary from physical complications, such as pain or shortness of breath, nausea, but also many needs across the social sphere. For example, if I am dying and if I'm a young person, what's going to happen to my young family? And all the concerns around that. It also affects the religious and spiritual parts of our lives. And so we need to be attentive to that. And and the psychological, very important. When one's facing an illness that may shorten one's life, one may experience, not always, but can experience a lot of anxiety, depression, etc. So palliative care is about improving quality of life.
In general, health officials who specialize in the practice say anyone with a chronic or terminal illness, including those with heart failure, kidney disease and are on dialysis, or those with end-stage lung disease, qualify for palliative care.
Sometimes in the development of palliative care, we can kind of get stuck on cancer as the main diagnosis, but palliative care as the way how we would ideally like it to be developed in Barbados is across all illnesses. Any person with a life-threatening illness, whether it's heart failure, renal failure, stroke, motor neuron disease, etc. All of those conditions would benefit from palliative care.
It does not treat a specific illness, but rather allows a patient to define goals of care for themselves with the help of a team of physicians, nurses, and social workers.
One of the things we also do is to teach advanced care management, advanced care planning. What do you need? If I ask you the question, what do you need in case we became ill? What are your requirements? Do you want to be put on a machine? Do you want to have this? That's advisable. It's not what we call a living will. It's not a will that you give me all of your property and I take it from you before you die. Is that you make all the plans of what care do you need? What do you want? Secondly, one of the things that we worry about is finances, and I want to stress that. Don't worry about the finances. Give us a call.
President of the Barbados Association of Palliative Care, Deanne Sober, says, so far for the year, the organization has provided help for 38 patients in the comfort of their homes. The goal, she says, is to provide them with this extra layer of support so they'll live through this difficult period in a minimum discomfort, be it a hospital or simply in the comfort of their homes.